So the first technique I'm going to show is the simplest psoas release, and it's super easy to learn. Basically, you want to mark gently with your palm and find the belly button. So right now, my finger knows where his belly button is. And then I can come out laterally from there to the edge of rectus abdominis. And right at the edge, just outside of it, is a little pocket in the obliques and in the abs where if I sink slowly in, you don't need to push at all. You want to think about like you're almost sinking into quicksand. And you want to sink in at an angle, not straight down. If you come straight down here, you're basically right on large intestines. So you want to make sure that your angle is 30-ish degrees towards the bodies of the vertebra. And so this is the first simplest contact. And with this, I can just use all fingers and slowly let his breath let me in until I can contact it. Now, if you're unsure you're actually on psoas, you can always ask a client, hey, leave your ankle on the table and just lift this knee a 1 millimeter. So go ahead, okay, so let go. And I actually felt that I was maybe a touch lateral there until I moved touch in, and then I felt the muscle move as he dropped his knee back down. So now I really know I'm on it. All right, so that's the first simplest thing. The next part of it is to add in some gentle rocking of the femur in the hip socket. And basically, I'm using the right hand to pin and stretch and just hold the belly of the psoas, and I'm rocking the femur in and out of the socket ever so gently. And that was gonna pull the fibers of the muscle back and forth under my fingers. And it basically gives it a little bit more of a release. The other cool thing, and you'll find this out in a different video where I talk about good cop, bad cop techniques, is that the right hand can sink in and be a little bit pressure, a little bit intense. And by adding movement with the left hand, you're hacking his brain into not having to feel as much intensity, because the brain prioritizes movement proprioception over pain proprioception. So when you add movement in, then the intensity of just contacting psoas here tones down a little bit. All right, and so that's sort of level 2. So for a lot of clients, just that very basic will be more than enough. If they've never had psoas work before, that's going to be pretty intense and valuable and probably a little shocking at first for them, and it doesn't need to be more than that. But if you've got somebody who's either you've worked on it a few times or is a very heavy athlete who's got a very strong psoas who might need a little bit more than that, we can kind of graduate up from there and make it a little bit more and more intense. So the next level I'm going to do with the same contact right here is have him bend his knee and put his foot on the bolster on the left side. So go ahead and do that. Great. And you can leave the other leg straight. All right, and so now what I've done is I've shortened psoas and given it more slack. I can find the same point of contact, belly button, lateral about 1.5 to 2 inches, depending on the client, on the outside of rectus abdominis. I'm gonna sink in. And now, first, if I just contact psoas, because it's shortened, it's gonna be a little easier to get in, and it's going to be easier to go deeper. How's that feel? If I gave 6 out of 10, yeah, and I say somewhere between a 5 and a 7 is usually where the interesting therapy happens. So now, again, I can now rest my hand on his knee and I can rock the femur in and out of the socket, and it is going to allow me to sink deeper with this right hand contact on this side, left hand on the other side, because I've shortened psoas as a muscle by having him flex his knee and raise it. So then the next level beyond that, everything I've done so far is either just contacting the muscle or me passively moving the femur for the client. The next level is to then have the client themselves move the hip socket in the femur in the hip socket while I'm contacting here. This gets much more intense for the client, but it's very instructive for their nervous system. And so I wouldn't do this as the very first time you contact psoas on a first client, but maybe a few sessions in and you still feel like it needs some work, this would be a really great way. So now, still contacting here, I'm just gonna have you wanna keep your foot on the bolster and you're gonna lift your heel just a millimeter to lift your knee into my hand. And let it go. So I found out that I was a little bit medial that time, so I'm gonna just come a little bit more lateral to make sure I'm on the muscle, because you'll feel the muscle if you're in the right place. Go ahead and lift, yeah, there it is. And let go. Good, and now I want you to just rock your own knee back and forth in the socket. Oh yeah, and I can feel the fibers of psoas pulling back and forth under my fingers. Great. Take a break. And sometimes it's nice after all that to just give it a gentle rock that isn't contacting psoas. So, coming back, now we're gonna make this even more intense. Again, you really gotta be careful. This is not the very first thing that you do with a client. You wanna know a few sessions in that they're comfortable with psoas work. You wanna know that they need it this deep. And so thinking in here, last time we had him lift his knee but leave his foot on the table. This time we're gonna have him try to lift the foot as well. And this is gonna be much more difficult. So a couple millimeters up, good, and back down. Yeah. And as you come back down and sink down, that makes that much more intense. And again, I can rock from there. Last but not least, here I go, free-forming. The hardest one for a client would be to have them extend their leg out, again, to come into that contact, and now have you try to lift your entire leg 1 millimeter. Good, let it go. And just to make it even tougher, I want you to think about very slightly tucking your tailbone to do that so that you're not using, yes. Go ahead and lift the knee, leg, the whole leg, great, let it go. And that's by far the toughest thing I've asked you to do today. All right, and hopefully after all that, we've got some real nice rolling of the femur, the ball of the femur in the hip socket. And we get to see some nice snaky wave motion in the lumbar spine on that side. I'm gonna come around and I'm gonna balance him out a touch on the right side. He's got an over loose hip socket as a client, so I actually don't wanna do that whole sequence at all with him on the other side. I'm just gonna do a little bit to help balance things. And I would recommend never really just doing one side with psoas. And I'm gonna come right back and just do the very first simple version where I contact and just rock the femur in the socket for the client. All right, and I can give a little bit of rocking just to check that I've got some real motion. Back to the lumbar spine. This is really great for all of your low back clients. I say this time and time again, I could stick a client face up and just do that and probably help their low back pain far more than all of the face down work that most people do on clients. Not to say that you shouldn't do face down work, but if you're not releasing there, this is gonna help them out a lot. All right, so the next thing, so that was all psoas. Again, psoas and iliacus both attach up on the inside to the lesser trochanter. Psoas comes across the pelvis and into the lumbar and attaches to all the transverse processes of the lumbar and the bodies of L5 through L1. Iliacus starts at the same place down on the femur, but then comes up and instead attaches to the inside bowl of the hip bone, right inside the pelvis. And really the only part of it that we can really contact cleanly is just on the inside of the ASIS. We're just going to get the sort of edge of the muscle there. We can contact both at the lesser trochanter. I'm not going to show that on YouTube because that's a much more advanced concept and you really need to know what you're doing with it. But these are relatively easy to learn and relatively easy to practice. So again, for the first one, we're marking from the belly button coming out laterally. For this, we're then going to walk down from there to find his hip bone, what lay people call the hip bone, what we call the ASIS, the anterior superior iliac spine, and right on the inside of it. So basically, I'm going to hook my fingers this way and try to come down at an angle laterally. So you want to make sure that you're on the inside of ASIS and that you then contact and come in. And just that can be really intense. All right, so we're gonna, again, we could go through all of the same sequences of like simple to complex movements we just showed with just that pin and stretch contact of just contacting the muscle. So I'll start with just contacting it, then I'm going through rocking passively for the client. And I could do each and every one of the other ones, and I invite you to try them out, especially with a client you've done multiple sessions with and you know is comfortable with psoas iliacus work. But for him, I'm not gonna do that because that would be overloading his whole system. So last but not least, I'm just gonna contact iliacus on the right side for him, which again, he's got, is it a labral tear that you know about, or? Okay. Partial dislocation. So we could potentially surmise a partial labral tear. And in cases like that, the structure itself is actually too loose. And so you would think, oh, let me loosen those muscles there. That'll help you out. And in fact, that actually makes it worse. So sometimes our job is to know when not to loosen something. All right, so now that we've done a fair amount of work on the left iliac psoas and just a little bit of balancing work on the right, I can come down here and just cup his heels and rock the femurs in and out of the socket and just check. Hey, now I've got some nice wave motion in his lumbar spine, and that's going to help out low back pain for a lot of these clients. And last but not least, so I talked about, but we're not going to show it today. This was all contacting where we can get at the bellies of those two muscles as we can. We definitely can hit the belly of psoas. We don't quite hit the belly of iliacus, but we get the edge of the belly of the muscle. But you can actually contact on the lesser trochanter the attachment points of both of those, the insertions. That is something that's much more advanced. I don't want to show that on YouTube and where I don't know that people have training. But we do have a live continuing education class on pelvic realignment where you would get to learn those. And you can check out links in the description below if you're interested for any of our workshops. And hopefully this was a valuable video. Please like and subscribe to our channel to get updates. And if you found this video valuable, I guarantee this video is going to help you out too.